everyone, welcome back. We have another dermatologist reaction video, and you can see we are joined by board-certified dermatologist Dr. Jenny Liu from Minneapolis.
Hi everyone, really excited to be here.
We're always excited to have you here. This video is going to be an interesting one because it is with Ibrahim. He is 26 years old, but he has the story of, you know, like going to the dermatologist when he was a teenager, getting Accutane, still dealing with acne and hyperpigmentation and everything. So I feel like he's going to have some interesting things to say.
Yeah, absolutely. Really excited to go over his video.
Just a reminder, even though Dr. Jenny Liu is a dermatologist, this is not medical advice. This is purely for some education and also for entertainment.
Hi Susan, hi Mixed Makeup. I'm Ibrahim, I'm 26 and I live in Brazil. Ever since I know myself as a human being, basically I have really oily skin and very acne prone. My main concerns today are hyperpigmentation and acne itself. I have some acne scars, as you can see, but they don't bother me as much as the hyperpigmentation does. When I was 16, I went to a dermatologist because I had really bad cystic acne, and at that time, it really was, it really had a huge toll on my mental health. And because I was in high school and etc.
I feel like he brings up an interesting point that people don't talk about enough, and that is when you deal with acne, especially if you feel like it's severe acne, and as a teenager, especially when other kids are already so brutal, finding something that they want to pick on you about. He talks about how it gave him, it played a lot on his mental health, right? What do you think about that? Do you see a lot of patients that come in like that?
Absolutely. I mean, when we, acne is one of the most common conditions, but it is a disease, and it's not just a disease of your skin, and a lot of people think it's like cosmetic. No, it's a true disease. It can be very painful. I mean, it can drain, can bleed, but also it can play havoc on somebody's mental and physical well-being. Yeah, absolutely. And that to mention not just the acne itself, but the scars and hyperpigmentation, and those can be permanent marks left on one's skin.
Yeah, I mean, he was saying that the actual acne scars don't bother him as much as the hyperpigmentation, right?
And that, being a darker skin tone can definitely be more challenging to treat as well. Yeah, absolutely.
Yeah, that makes a lot of sense. I love that he brought that up because I think people don't discuss it enough, and it makes me feel, anytime I talk to somebody that has any skin condition, whether it's bad or like not that bad to us, it's however you perceive it, right? Sending some love first off. And then, the other thing I think is interesting is, I do see this question a lot, like, is there a difference between men and women's skincare?
Yeah.
And I think it really, I don't know, is it really just a hormonal thing at the end of the day?
Yeah, so when it comes to acne, we know that, the cause of acne is multitude, but hormones, men and women, the androgens, all play a role. I do feel that in men, it tends to be less cyclical. I know that he mentioned that he had these cycles, but that could be less of the actual hormone fluctuation, maybe external too. Whereas in female and women, it's literally those hormonal cycles that kind of run with our period. Along that same line, I do find that in men, the treatments, the right ones, can be a little bit more sustained, in the sense like with women, it's really the hormonal component that you have to tackle that is more long-term. And men, for him, possibly, and I see this a lot in my patients, is, for men, when they go on Accutane, for the majority, once they complete the course and treat appropriately, often their acne doesn't really come back very much, and so they're able to just use maybe topical things or have a good skincare routine, compared to women, often when they even go on Accutane, their hormonal acne still comes back.
Because
so there's
hormonal issues and fluctuations are always happening, especially when women get pregnant, and they stop being pregnant, then they breastfeed, all that kind of
those
stuff.
changes.
For sure.
And by going to this dermatologist, and they prescribed me Accutane, and I was on Accutane for 3 months, and I couldn't handle the side effects anymore. After these 3 months, I felt like my skin really cleared up, but the side effects were really difficult to deal with. Mainly, there was a lot of dryness, and my mouth was really dry, and any lip balm would not be enough to moisturize my lips, and that's why I stopped using Accutane.
Till as old as time. I hear so many people say that they have gotten on Accutane and could not tolerate it.
Yeah.
Why is it always prescribed then? And then why is this what we're always hearing?
Yeah, I mean, Accutane, or it's now called Isotretinoin, is an oral medication, derivative vitamin A. And, you know, you can think about topical retinoids, they are really drying. So think of that at a more systemic body level. So dry skin, but not just dry skin, dry lips, dry nose, dry eyes. It is a really good medication for the right individual. So it's not for everyone, but in Ibrahim, I can appreciate why his dermatologist prescribed him Accutane. And, you know, when we say there is really no cure for acne, Isotretinoin is kind of the closest that we can get and really try to modify one's skin in removing that acne. Obviously, it does come with really harsh side effects, but I feel that, I don't know how, you know, dermatologists practice in Brazil, but, you know, at least in my practice, that is a conversation I have with my patients, the serious side effects, and there are ways we can manage through it, and majority of the people are able to go through it, even in the dead of winter in Minneapolis when it's super, super cold, but it is definitely something you have to just feel comfortable in going into, and also feel comfortable with the dermatologist who's prescribing you the medication.
Well, my first thought is, and obviously this is why it's great to have your perspective, the way like tretinoin, for instance, you can get it at different percentages.
Right.
Can you do that with Accutane?
Absolutely, absolutely.
So would that be maybe one of the first things that you would try first is to maybe like lower the dosage?
Yeah. So, you know, with Accutane, we do know that what we want to get to is a therapeutic goal. Usually that is a cumulative dosage of the medication based on individual weight or like a clinical improvement. And what we do know that individuals that tend to need a second course are those who have severe acne to start with or finish the Accutane too soon. But yeah, Accutane or Isotretinoin does come in various dosages. And one of the first things I do when patients don't tolerate it well because the dryness or other side effects is to go down the dose and see if that makes a difference.
That's interesting. So if it were you as his dermatologist, you might have been like, instead of you completely cutting out because you're seeing a difference in your skin, let's lower the dosage.
Yeah, or you know, there are other tricks we can do when it comes to combating that dryness.
Give us some tricks.
Yeah,
Let's hear them.
Basically, this is where you don't want to use anything, but just like a gentle cleanser or just even water, heavy duty moisturizer, or even like petrolatum and chapstick, like petrolatum based chapstick or Vaseline, and even sometimes when it's really, really bad, prescription topical steroids to really cut down the inflammation, especially for the dry, chapped lips. And then adding little other tricks like humidifiers in the bedroom when you're sleeping. Some people might even need like eye drops or even like putting Vaseline inside their nose to minimize nosebleeds. I mean, there's a lot of things that we can do to work with the patient when they're going through Accutane that can really help with their treatment course.
Got it. Yeah. Okay. So it sounds like he maybe should not have gotten off of the Accutane so quickly.
Yeah, I think he probably could have tolerated it. Yeah. And completed
just
the whole
like push
thing.
through it,
Yeah.
push through it and find some tricks.
And it wasn't until a few years ago that I started being concerned about my skin again, because I started having a cycle of breakouts, really bad breakouts, over and over again. And I decided to go to 2 different dermatologists and to have their separate opinions on what I could do for the breakouts and for the hyperpigmentation. What both of them basically said to me was that there wasn't any way I could deal with these issues without getting procedures done, like lasers and chemical peels. So I took it upon myself to research skincare and skincare ingredients, products, and for people online that were going through the same situation as I was.
So he talked about how he went to these 2 dermatologists. I already sensed from that, seeing 2 dermatologists, he was like untrusting, right, of something, and I'm not quite sure what that is. It's very defeating, I guess, to hear from, especially your dermatologist, especially 2 dermatologists, telling you that the only way you're going to correct something is with these cosmetic procedures.
Yeah, that's absolutely not true. I mean, medical treatment, first and foremost, we know is effective. Chemical peels can be an adjuvant to proper medical treatment, but definitely is not first line. I mean, it can be helpful in treating some of the hyperpigmentation and scarring, and so can laser. But yeah, it's not.
It's not the main treatment.
Yeah, and in fact, I don't think I would ever use laser to treat active acne. Maybe some like pulse dye laser for the redness. But yeah, it's that's not what I would do.
Yeah. So giving you credit, I think trusting your gut, you know, and knowing that, you know, something just didn't feel right here and doing a little bit more research. And maybe it's just doing a little bit more research to just go back to your dermatologist and say, I've got some questions now.
Right.
So for the past 4 months, I came up with a skincare routine that I've been, you know, using in a solid way. And I'm going to share with you guys today. So in the morning, I always start with a cleanser. The cleanser I use is the Roche-Posay Toleriane Purifying Foaming Cleanser. It really is a standard cleanser for me. It doesn't overly strip my skin. After cleansing and patting my face dry, I use the SkinCeuticals Serum 10. It has L-ascorbic acid, ferulic acid, and vitamin A, as the ferulic does. I read online that this formula was more oily skin friendly, so I started using this one.
I mean, cleanser, very gentle, very hydrating, not stripping like he said, so it's a good one. And then the serum, we love SkinCeuticals here.
Absolutely.
Great brand, and you're gonna get a lot of clinical studies behind some of their products.
Yeah, it's definitely one of my favorites. So.
As far as the vitamin C for acne-prone skin, I feel like that's totally fine. What do you think?
I mean, there's a lot of, you know, talks about like vitamin C breaking you out. I think it's more, is it truly the irritation? I think less likely to be actually causing acne. So you just have to find a formulation that works well for you.
I use the Senka beauty lotion. I think this is a Shiseido brand. The main active ingredient is tranexamic acid. It's really hydrating, and I feel like it has some extra benefits due to the tranexamic acid.
I have not tried this product. I don't know if you have.
Neither have I. Yeah.
But tranexamic acid is great. It's, you know, it's, if anything, it seems sort of like an interesting product to me. I wonder what the texture is and stuff, because it has like mineral oil in it, which could technically be a little heavy, but could also be formulated so well that maybe it's like a nice emulsion. We have no idea.
After this lotion, I use the Acwell Licorice pH balancing toner. I feel like this really helps calm down redness, and it really helps with the inflammation caused by acne.
I mean, looking at this Acwell product, this sounds like a dream product for me. I love licorice root. Yeah. This is the main ingredient in here. There are a lot of nice extracts in it too. There's like Camellia sinensis. And this is a toner. Again, I would have loved to have seen the textures. Yeah. I would swap. Would you swap?
Yeah, I think usually toners are a little bit lighter than lotion, so would have wanted to use the toner first and then the lotion.
Yeah, again, that Senka beauty product that he mentioned, it's called a lotion. It could very well be just more of like an emulsion that feels a little bit lighter, like a serum. Yeah. But it, you know, definitely something to swap. I almost feel like because he's got the SkinCeuticals, the Senka, and the Acwell coming up, you know, he's really targeting his hyperpigmentation. So he's serious when he says that the hyperpigmentation bothers him.
Yep, absolutely.
Do we feel like maybe we can condense this though and make it, I don't know, almost like looking for products that have all of these ingredients?
Yeah,
right?
and there are lots of them out there that has like tranexamic acid and licorice root and, you know, green tea extract and other ingredients like kojic acid as well. I definitely think he can condense them into one.
Yeah. Or maybe like at least two, like knock one out. Or maybe we'll see, maybe for nighttime, maybe we can move something down there.
Absolutely.
After this toner, I go in with the moisturizer by Clinique. It has the uneven skin tone cartridge in it. It's the Clinique ID hydrating jelly. I feel like it's a great lightweight gel moisturizer, and it's perfect for using during the day. This cartridge has caffeine, a derivative of vitamin C, and some salicylic acid as well.
You know, I think a lot of people don't pay enough attention to Clinique. I feel like Clinique still has some really great products on the market. Absolutely. And especially for people like in Brazil and stuff, I always get messages from people being like, the products you talk about are not available where I live. I feel like Clinique is one of those brands that does offer a lot of great products. and this is one of them. What's interesting about this, so again, he's got the vitamin C derivative, which I think is totally fine to have, you know, in combination with true ascorbic acid. They work really well together. And then it's got the salicylic acid in here. I'm willing to bet that the salicylic acid in here is not in there for its exfoliation, but for its anti-inflammatory benefits. And then the caffeine, which we know is just great. There's also a couple of like extracts in here that look like they would be great. I mean, this says it's for uneven skin tone. So again, he was really trying to tackle the skin tone issues, which is very interesting to me. I do feel like there are maybe too many products for him. If he's saying that like acne and oiliness is his issue, it might be like too many layers for him.
Absolutely, I agree.
Yeah?
Yeah.
On top of that, we still haven't even gotten into a sunscreen for him yet.
After this moisturizer, I use a sunscreen. I'm in love with the Bioré UV Watery Essence. It has a really shiny finish. At first, I was really afraid of that, but I got used to it and I quite like it today.
You know what's funny though? So okay, I say all of that and then I hear him say he loves his sunscreen and then he was afraid of the shiny finish, but then it actually started to look good. And I wonder, you know, like, I feel like he knows his skin though. And so it's like in some ways, like without seeing him apply these products, maybe it's not too much for him. I don't know.
Not. Yeah, I mean, he doesn't complain of like irritation or like sensitivity. So maybe it's fine.
I do believe in, you know, especially when you're targeting dark spots and hyperpigmentation, you're creating like a team, you know, of like all these active ingredients.
Yeah.
I guess ideally it would still be better if he condensed.
Yeah.
But he is finding all of those ingredients that would target his dark spots.
If I need to go outside and run any errands, I use the Missha waterproof sun milk because it's waterproof. I sweat a lot. I'm really oily when doing outside activity. And I feel like this protects me a lot.
I mean, he's using his sunscreens. He knows. You can tell he knows what he's doing.
Yeah, he definitely does.
Do you have any notes about this morning skincare routine?
Yeah, the first thing I noticed is that his ongoing acne. I mean, he's mentioned he's been having oily skin and had really struggled with acne, and we can still appreciate that he has ongoing acne, some of them even deeper on the lower cheeks. And so, given that we know his hyperpigmentation is from his acne, I first and foremost would like to see him, you know, add in products or, you know, see a dermatologist that he feels comfortable and trust to address that first, to get that under control before I really try to tackle his hyperpigmentation.
Because it sounds like the hyperpigmentation, while that is what bothers him most, it probably wouldn't be there if he just had the acne.
Yeah.
Right? Okay, that makes a lot of sense. So in that case, what would we suggest, right? Like obviously you're saying maybe go see a dermatologist or something, but let's take a look at his routine, these products that he just said that he has, right? So instead of just completely washing away these products, maybe it would be more so getting like one product in there, right? That might be handling his acne, maybe like a salicylic acid or a benzoyl peroxide cleanser.
Yeah, I mean the thing that he you know first mentioned, he really likes the Roche-Posay foaming cleanser. I mean there is one that has a lipohydroxy acid, so it's like a derivative beta hydroxy acid, a little more gentle, and he can definitely substitute the cleanser into his current one, or he can consider adding in, like if he really likes the toner or the lotion. Sounds like he's able to handle all of this, but maybe something of that formulation with a salicylic acid, and see maybe not using it every day but a few times a week, and see if that makes a difference.
So whenever anybody says that they have oily skin and they're dealing with acne and stuff, I immediately look for that salicylic acid product in their routine. So I do feel like that might be something that would be interesting, especially for his morning routine.
Another one to consider is like niacinamide.
Oh yeah, that's
that can be really helpful in some of the sebum control and offer a little anti-inflammatory effect on his, also tackle his hyperpigmentation too.
That's
so
true.
Acne, sebum, and hyperpigmentation can all help with that.
Yeah, for sure.
And so maybe looking for a moisturizer with niacinamide, or like another like maybe toner if he really likes that.
Either cleanse with a salicylic acid cleanser, right? And then maybe using like that vitamin C, and then picking one of those hyperpigmentation products. I love tranexamic acid, but I almost feel like I like the Acwell product. It sounds better to me in some ways, and I love that it has licorice root extract in it that will also help his hyperpigmentation anyway. And then maybe that moisturizer, right?
Sounds like a good routine.
And I think niacinamide would be really, really great, whether you get it in a separate serum or you get it in like a moisturizer, like you were saying.
Yeah.
For the night, I always start with a double cleanse. The cleansing oil that I use today is the Black Hat Off by Missha. It has tea tree oil. I don't feel like the tea tree in here bothers my skin at all. I quite like this product. It's really lightweight, and even if I massage it into my skin as I'm, before emulsifying and massaging it in and removing the sunscreen, I feel like there are some grits coming out, like these tiny scent particles. I don't know if that's oxidized sebum that's clogging up my pores. That's probably it, but I feel like this one helps get these out.
I have not tried this cleansing oil. Have you? It sounds great if he's enjoying it. I always appreciate people with oily skin when they start using a cleansing oil. I'm like, yes. Looking at these ingredients, the main oil is soybean oil, and soybean oil can be high in linoleic acid. And I talk about this a lot, where I think that if you have oily or acne-prone skin, if you can find oils that are high in linoleic acid, it actually helps your skin.
Yeah.
And what he might be experiencing is his skin almost needs those lipids. Yeah. And so it's just balancing him out a little bit too and helping with all of that. I love that he did the caveat of the tea tree oil, it's not bothering my skin. He's like, I'm talking to a dermatologist. I know she's gonna mention this. What do you think of tea tree oil?
I think it's fine, but I also is not one of my top things that I recommend. I think salicylic acid, I would prefer that over tea tree oil for many things.
For sure. But if in this case, it's fine if it's not bothering him, right? I love that he's double cleansing.
Yeah, absolutely.
After the oil cleanser, I go in with the CeraVe facial foaming cleanser. I quite like this one as well. I feel like it's very similar to the Toleriane one.
As far as saying, though, that they seem the same, pretty much the same thing. Yeah. This is another opportunity where he might be able to get in some salicylic acid, right?
Or even add in benzoyl peroxide is one of my favorite.
Yeah.
After cleansing, I go in with the Missha Time Revolution First Treatment Essence. It's really hydrating, and it has yeast ferment extracts. And also, I believe it has niacinamide as well. After the essence, I go in with the iUNIK Black Snail Restore Serum. It has snail mucin and niacinamide as well. It's really, really hydrating. It's not goopy at all. I feel like it goes on really well in my skin, and I quite like it.
All right, so just saying those two products, I already have a couple of thoughts, and now I'm like, okay, I'm rethinking the morning routine, how we're gonna split things up in the nighttime routine. So I kind of want to just let him go, just see what else he's doing, right?
Yeah.
After that, I spot treat with the La Roche-Posay Effaclar Duo Plus. This helps with inflammation and also helps with the dark marks that are left after the acne has healed. I quite like this one.
Okay, so there you go. He does do the benzoyl peroxide at night.
Yeah.
Okay, what do you think of this product?
I love this product. I use it myself personally. I think it's definitely one of the more gentle leave-on benzoyl peroxide products to help with spot treatment. So he's definitely using it the way I would want him to. And also the lipohydroxy acid, which you mentioned, is a little bit of a mild exfoliant, may help a little bit with sebum and acne as well. So yeah, I think it's a great product.
Great product, and great for spot treating. Yeah. All right, let's keep going and see what else he has, and then I have so many thoughts already.
Yeah.
After the Effaclar Duo Plus, I go in always with a moisturizer, and the one that I've been, it's almost finished. And the one I've been using is the Cosrx Advanced Snail 92 all-in-one cream. It's a really lightweight moisturizer. I love this for my oily skin. This one has really made me fall in love with moisturizers that I can use at night, and my skin doesn't wake up dry or oily either. So I quite like this one.
I mean, I have to say, I just got influenced. Yeah, I wanted
try myself.
I'm like, wait, this sounds like a magic cream. What is it that makes him? I mean, it has some really nice ingredients in it. There is that snail secretion. You know, for a lot of people that don't know about snail mucin, do you know a lot about what it does for skin?
You know, it's a great humectant, you know, and there is some literature, like it's really popular in Asia. So great humectant, maybe helping with the skin barrier repair, even potentially have some antioxidant and some anti-aging properties. But I think first and foremost, it's just a great humectant and helps with skin healing. There's some literature on like wound healing and snail mucin.
That makes sense. I mean, it is what protects the snails, right? Yeah. It has allantoin in it, which is also a really nice, great, you know, healing ingredient. Arginine. Yeah, there's some really nice ingredients, and it's actually very straightforward too in what it has.
Yeah, I just love the fact that he loves this moisturizer. I mean, that's really like skincare. It's like finding the product that you just love and works well for you.
Yeah, that is true. And that's why it's a little bit of a journey as well. It's still going, which is surprising. Whenever people have oily skin, I feel like I don't see this many different products. So he's definitely a skincare enthusiast. I love that. And I appreciate it. I am right there with him, but I just want to see what else he's got.
Always after moisturizing, I alternate between a chemical exfoliant and a retinoid. The ones I've been using are the glycolic acid cream by the Brazilian brand Creamy. It's just glycolic acid, basically. It's in a cream vehicle. I quite like using it over the moisturizer because I feel like the moisturizer buffers the effects of the glycolic acid, and this 10% cream I feel like it's really quite strong, you know. And on the days that I don't use chemical exfoliants, I use the retinol by 0.3% by SkinCeuticals. There was an accident with the packaging, as you can see, but I quite like this one. It's a really creamy consistency. It doesn't, it leaves my skin irritated at all. I feel like this one is really cosmetically elegant, and that's the price you pay for SkinCeuticals, I believe. I quite like this one. I think that's it, guys.
All of these products that he's got in this nighttime routine, almost all of them have niacinamide in it. And, like, it's funny because we were saying, like, oh, he'd benefit from niacinamide. So I almost feel like there's a little bit of, like, a switcho-changeo happening here, too, that I would prefer.
Yeah, like, I feel like he really tries to target one category in the morning and then, like, another one at night, where I think mixing a little bit of both can be helpful.
Yes, agreed. So I kind of go back a little bit to that morning routine. I actually still stand by, I think he would benefit from a salicylic acid cleanser.
I agree.
Not because of even acne. I almost think like breaking up that oil that he might be experiencing, but in a gentle way, right?
Yep.
And then, you know what I would do is I would take that Missha toner, and it's hard. This is where I understand him so much. Like that Acwell balancing cleansing toner, I'm gonna assume it's really nice. I bet you I would even like this one too without ever trying it. And so it's like hard to put that to the side and be like, well, I've got this other essence. So I would almost prefer that he goes in with that Missha essence in the morning.
Yeah, and with the yeast extract, you can get some brightening effects with that too.
Yeah.
So you are, and also by just like taking care of your skin and making sure it's hydrated, you're kind of working to tackle, the hyperpigmentation in a way by keeping your skin barrier healthy and minimizing the inflammation.
Right.
Yeah.
And then from there, I would go in with that vitamin C. I don't know if they have it available, but if he's enjoying that vitamin C from SkinCeuticals, maybe just to add a little bit more work on like his acne and oil would be that newer silymarin
with like silymarin and salicylic acid and vitamin C. Yeah.
So that might be one to try next time when you're buying a SkinCeuticals vitamin C. And then maybe it's like choosing.
Right.
It's like choosing one more of these products if he feels like his skin can handle it. I think tranexamic acid is kind of where it's at for people that are dealing with dark spots. So I would almost go with that over the Senka one. I think the Senka one I would probably toss. Not toss, like get rid of it because it's bad, but just because if we're choosing.
Yeah, I agree.
And then his sunscreens are great.
Yep. Love it. And then just make sure you're reapplying throughout the day, especially if you said you sweat a lot, and because that does come off and that really can impact the hyperpigmentation, especially when you're trying to tackle that. So.
And then nighttime routine. Okay, we like his cleansing oil. For his cleanser, what do you think?
I think this would be another way to add in an acne fighting ingredient. So here, the second step of his double cleanse, I would personally love to like add in like a gentle benzoyl peroxide cleanser. So the CeraVe, acne foaming cleanser, that one I love, that's very gentle, I think would be a good potential replacement for him here. And then so if that is the case, then he wouldn't be obviously spot treating with the benzoyl peroxide, because that could be maybe causing some of the irritation.
Oh, that's interesting.
Yeah.
Yeah.
I don't know.
But he did say he likes that.
Yeah.
So could he use a benzoyl peroxide cleanser and then also spot treat with the BP?
I think, yeah. I mean, obviously there are no like rules, and if he's tolerating it, by all means, go for it. Yeah.
Yeah. I would still keep that essence in here. I feel like this essence is good.
Yeah.
The only reason I was saying to move the Missha to the morning skincare routine is because he doesn't have any products with niacinamide in the morning.
Yeah.
And I feel like niacinamide is a key ingredient for him. He's obviously packing it into his nighttime skincare routine with so many different products.
Right.
So I would at least have one of those products be up in
Diverting
the
it
top.
a little bit, get some benefit.
So that was the only reason why I would say that.
Yeah.
So, I almost don't think he needs like this iUNIK Black Snail serum with his CosRX Snail all-in-one cream.
Yeah.
Right?
Right.
And then glycolic acid, I think that's a great glycolic. It sounds like it's a great glycolic acid. 10% is, I always feel like 10% is where you want to get. It's where I think the most studies are, right, with glycolic acid. Again, it has niacinamide in it too.
Yeah,
so he's kind of getting all of that. And then obviously the SkinCeuticals retinol.
Yeah.
Maybe it could be trying out a little adapalene, like swapping, maybe it's like doing a little bit of both the over-the-counter and the adapalene or something too. Yeah. I mean, would it be terrible if he keeps all these products in his skincare routine? I don't know, right?
Yeah, I think it sounds like it's working well for him overall, in the sense like it's not causing a lot of irritation. He doesn't really complain about like products burning on his skin. And I definitely don't get a sense that it is extreme to the point where it's like breaking him out more, in the sense like his skin barrier is compromised, and because that can lead to like actual acne breakout, not like breakout in like bumps of irritation. So I definitely think this is a perfectly fine routine. Like I said, I just wish I would see more acne fighting products in here, because that is literally the drive behind his hyperpigmentation.
Got it.
And just lastly, I know, the acne is very much, can affect one's, mental health and his physical well-being. And so really want to let you know that you can hopefully find a dermatologist that you can really trust. And it may take a few tries, but finding one that you really trust, that you can work really well with treating your acne, is really, really important.
That's the overall takeaway, is that you would like to see him treating his acne. Then he would deal with less hyperpigmentation. And, when it comes to these cosmetic procedures, after he treats his acne,
absolutely,
the chemical peels and the laser treatments, what do you think?
I think that's perfectly fine if that's something that he is interested in and financially able to do, because they're not cheap either. But yeah, it's like chasing hyperpigmentation when you have active acne. The same thing with acne scars. When you have active acne, that is the first and foremost thing you want to tackle. Otherwise, it's just like there's no end, and there's no and
you're just getting in a cycle. Well, thank you so much, Ibrahim, for sending us this, and for also just supporting and watching and everything. I really am so happy to hear that you have seen a change in your skin. You've learned so much about skincare. It always makes me feel really good.
Yeah, absolutely.
Thank you, everyone, for watching this video. If you want to send in a routine, go ahead and look in the description box. There will be some information in there. Where can everyone find you?
Yeah, you guys can find me on social media, on Instagram at Derm.Talk, as well as YouTube. I would love for you guys to check out my YouTube channel at Dr. Jenny Liu.
I love it. You can also find me on Instagram. I'm at Susan Yara, and we'll talk to you soon.
Bye.